Thank you all for coming. I think most of you know me by now. I've been back at the Commissioner's office. I'm the one that sends all those emails out about the health and wellness, always bugging people. So I'm glad you guys came. Today, Wendy Dillingham is here from Subco, representing our healthcare. A couple things in the handouts I want to point out. The big one that everybody wants, the rate sheet. I don't know if you noticed, but our healthcare rates did go up. I think Wendy's going to elaborate that on a little bit. For the employee, how it affects you, the commissioners took a majority of the increase. The employees will be, if you're on a family plan, you'll have a $2 a month increase. If you're on a single plan, it'll be a $1 a month increase. Okay? And are all of you participating in the wellness program? Everyone is? Okay, so you log into the new website, no more points, no more accounting, you just check off the activities you do. For your physical, you don't need to have a physical form signed and turned in, you just simply check off that you did it. Subco can verify that your physical was completed by going through your healthcare. Okay. So it's real simple. When you want to do your blood screening, go under My Appointments in the program, and follow, whether you're on-site or off-site, and follow those instructions. It's quite simple this year. I think everyone will find it much easier than in the past. Okay? Any questions on the wellness program at all? Okay, take it over, Wendy.
Thank you. As Kelly said, I'm Wendy Dillingham, and I'm with the County Employee Benefit Consortium of Ohio, which is the entity that Geauga County belongs to. And we now have 43 of the 88 counties in the state of Ohio, which is a huge growth from when Geauga County joined, because I think Geauga County was our 16th or 17th county. So our whole purpose is to provide affordable benefits for county employees. And we've been around, our first year of operation was 2004, and how we came about was some counties coming to CCAO, the parent company, the County Commissioners Association of Ohio, and indicating that they were finding themselves unable to really provide benefits for their employees, and could Subco, CCAO perhaps help them by forming a pool for counties to purchase insurance. So it took a number of years to be able to get that off the ground, and then it did. And so we started with 4 counties, and then 6, and then by the first full year of operation, we had 10 counties. So I've been with Subco since 2006. The medical provider has always been Anthem, but every 3 years we do go out and do an RFP to see if that's the best fit. One of the things that is always in Anthem's favor is they have the largest network in Ohio. And because we're serving counties in the very northeast part of the state, the northwest part of the state, down in the southern part of the state, and also in the central, we have to have a provider that has a good network throughout the whole state. So individually, you might look at this particular provider and say, oh gee, their network is really great in northeast Ohio, but they don't have any coverage in the southern part of the state. Or vice versa, you might have somebody really great in the southern, but they're not covered in the north. So we always have to take that into account, and then also the discount arrangements that they have. Anthem has always, and we work with a consultant who reviews it, has always come out #1 as far as all the categories. As you're aware, 2 years ago we did change our prescription vendor, and we moved from Express Scripts to Anthem Prescription. So we do look at, and we do make changes. I mean, we've changed our prescription vendor a couple times based on what the RFP says. So the types of benefits that Geauga County has with Subco is you offer medical and prescription, which come together, and then they also offer dental through Delta Dental. I'm not going to go into a lot of detail on the actual plan design, because nothing about that has changed for the last several years. The majority of employees here in Geauga County are enrolled in the plan that's called 1C, and the plan designs in your book start on page 24. 1C is the plan that has the $300, $350 single deductible, $700 family deductible. And what that means is no one person will ever need to meet more than the $350, no family more than $700. So you have 2 people on the plan, you each need to meet a $350 deductible. But you have 3 or more people, they can meet that $700 before anybody individual meets the $350. Once the deductible is met, then your co-insurance, those things that have a co-insurance responsibility kicks in. And your co-insurance on this plan is 20%, meaning the plan pays 80%, you pay 20%. There are also certain services that are specific co-pays for office visits, urgent care, and emergency room. Deductible does not apply. There's a flat dollar co-pays. So you're going to your primary care physician, you pay a $20 office copay. You're going to a specialist and you're going to pay a $40 office visit copay. Everything, copays, co-insurance, deductible, contribute to your out-of-pocket maximum. And on this plan, it's a $2,000 individual or $4,000 family out-of-pocket. And I'm talking strictly about the network benefits. If you look at the summary in your book, there are 3 columns that list the benefit. The center benefit is network, and the last benefit is non-network. The reason I don't really go into non-network is here in Geauga County, 99% of all claims are for network providers. So it's a very small percentage that are non-network. Nothing about that benefit as such is really changing. The other plan that we have a small number of people in the county on has a $1,500 single deductible, $3,000 family deductible, $4,500 single out of pocket, $9,000 family out of pocket. And the differences are the deductible and then the co-insurance percentage, which is 50% on that plan. And then the office visits, it's $25 for a primary care and $50 for a specialist. So that's all I'm really going to say about these plans at this time. Everything is the same as it has been. What I am going to concentrate are some of the handouts that I gave you. And the first one we're going to look at is this one that goes over a number of different plans. It's the one that's blue at the top and then the different green and white sections. And if you remember when I've come up here previously years, I've encouraged you to download the Engage application onto your phone so that you had the ability to access your benefits from that application. You could put it on your phone or your laptop or an iPad, and it allowed you to access all of your benefits, and you have an ID card right there on your phone. It would show your claim history. As of January 1st, the Engage application is going away. So if you sign in on January 1st, it's going to tell you that application is no longer available to you. We are replacing it with Sydney Health, which is Anthem's own application. You can download Sydney right now. It's eligible to you. You will need your Anthem ID card to download it for specific information. As of right now, when you download Sydney, it's going to be able to link you to anything Anthem. So it'll link you to Anthem medical benefits and your Anthem prescription benefits. You'll have your ID card available. You can look at your claims. As of January 1st, it will become more robust, and it will link you to your Delta Dental benefits. It will link you to the wellness program. What we found with Sydney is it's a much easier to navigate program than Engage was. And because it was designed by Anthem, clearly it works very well with the Anthem system. Less clicks, less searching around. It's a much easier system. I recommend you remember, and maybe you want to even download it right now, because you don't want to be January or February trying to use that Engage application and discovering it's not working. You want to be sure that you have the new one that does work. Live Health Online, we can't have a meeting without mentioning this, and during the last 18 months we've lived through, Live Health Online has been very busy for our members. It's this application that allows you to see a doctor virtually. It's available 24 hours a day, 7 days a week, 365 days of the year. You do need your Anthem ID card to register. It's zero copay to use this. This is not meant in any way to replace your family physician. This is for that unique situation. Maybe you could go to an urgent care. If you could get into your physician, maybe you'll be going to your physician for that kind of thing that you need care right away. For example, things we see it used for a lot are poison ivy, pink eye, strep throat, those types of things that if you could get the medication, you'd be on your road to feeling better. You do have to have an ability to do this video. So you download it to a smartphone, an iPad, a laptop, but there has to be a camera so that the physician can see you. When you download it, it's going to ask you where you live, and you're going to put the state of Ohio, so that the physicians that come up are licensed to practice in the state of Ohio and write you a prescription. When you sign on and you're going to utilize it on the medical portion, the longest wait time I've ever heard anybody have was 10 minutes, and it will just tell you, you select a physician, and if you select that one, it may say, the physician will be available within 10 minutes, you're in a waiting room. Usually there's somebody available immediately, and you get to see them. As I said, it's available 24 hours a day, 7 days a week, 365 days of the year. When you are traveling, you can also use Live Health Online. You just need to change your location. And we've had a lot of our members that have found this really beneficial when they've been on vacation. So for example, you and your family are in the Outer Banks and somebody becomes ill. You change your location from Ohio to North Carolina so that the physicians that pop up are ones that are licensed to practice in the state of North Carolina and that can write you a prescription in North Carolina. We've had a lot of members who've said it's saved vacations when a child has become ill or somebody in their family has become ill. The other thing that we hear a lot about is you get to your vacation destination and you realize you've left your medication at home. You can call in and they can do an override with the prescription company to allow you to get a 7-day fill while you're on vacation. So it's just available for your convenience. As I said, it is in no way meant to replace your family physician. It's just for that additional situation. In addition to Live Health Online Medical, there is Live Health Online Psychology. And this allows you to see a mental health provider. Once again, it's a video type of situation. They are not available 24 hours a day, 7 days a week, 365. This is a situation that when you register, you are making an appointment to see them. And the appointments are more traditional. They're not going to be seeing you at 2 o'clock on a Sunday morning. It's more traditional hours. There is no cost for either of these services on your plan. It's zero copay. So be aware that it's something that is available to you, particularly in this day and age. A lot of us may feel that it would be benefit from speaking to a mental health professional. So be aware, this is another service that's available to you. The next thing on our list is LARC Diabetes Program. And in your book, there is information on the LARC program on page 18 and 19. Previously, we've talked about the pre-diabetic programs through Solera, and Anthem has changed their vendor as of October 1st. They are going to LARC. If you're currently enrolled with Solera, you can see it through till the end of the 16 weeks that you enrolled. But as of October 1st, the new vendor with Anthem is LARC. And it's a pre-diabetic program. It's diet and exercise. There's a 1-minute quiz you can take to see if you're eligible. It is totally a virtual situation that you're going to be seeing them using an application on your phone, your iPad, or your desktop if it's got a camera. You can also communicate through email and text if that's your preference. You'll have a coach in this program. And as I say, it's diet and exercise. Immediately they're going to send you a scale. And they're going to communicate with you. They're going to work with you on what you're eating. They're going to make some suggestions. Once you meet certain goals, they're going to send you a Fitbit. It's free to you. And this one does not have that 16-week. Although we never limited our members, the Solera program was to be a 16-week program. If people were being successful, we just said roll it over and let them continue. This doesn't have an end date as long as you are continuing to make progress within the program. So that's the new program, LARC, and it's effective right now. The next thing I want to mention is Smart Shopper, and we premiered this last year. But of course, we didn't do meetings last year, so we didn't come out and talk to people. We did it through handing flyers out and having Kelly send diligently many emails about it. On page 16, there is information on the Smart Shopper program. For years when we've come out and held meetings, we've talked about being an informed consumer and that there were tools that Anthem has available, that you can compare costs, and encouraging people to, if it's a choice of where you go, look at what the cost is going to be. Save money out of your pocket, save money on the back end of what the overall plan is going to cost. And a lot of our members are pretty good informed consumers. Well, we decided we'd like more informed consumerism. So we're going to pay you to be an informed consumer now. And that's exactly what the Smart Shopper program is about. And these are for procedures that you're planning ahead of time. This is not for emergency situations. because you actually have to enroll with Smart Shopper to utilize this program. Let's make a scenario. You've been having problems with your knee for months, and your doctor says, I really think we need to order an MRI to see what's going on. There's a huge cost difference between where you go, what the cost is going to be for an MRI. So you call Smart Shopper. They're going to ask for your insurance information, your Anthem, so that they can get that logged in the system. They're only going to tell you about providers who are in the Anthem network. They will also, in addition to telling you the cost, they will make their quality available for you to see. And they'll discuss it with you. How far are you willing to travel? Are you willing to travel 25 miles, 50 miles? How far are you willing to travel from your home? And then they'll bring up Anthem network providers for what you're having done. And they'll say, well, if you go here, it's going to cost this. If you go there, it's going to cost that. If you go here, it's going to cost this. It's your decision. If you select one of the more cost-effective providers, they're going to put you in the program. They're going to ask you, would you like us to make the appointment for you? They can make the appointment for you. And then, as I said, if you selected one of the more cost-effective, once your claim's received by Anthem, they're going to send you a check. And they're going to tell you up front how much it will be. The largest check that will go out is $250, which is for a pretty significant cost difference. For the people that have been participating in the program this year, most of the checks are between $50 and $75 for that range. But it's up to you. There's no mandate for you to use it. It's just another tool that's available for you to save money out of your pocket and be an informed health consumer. Where we see huge discrepancies, as I said, on radiological procedures between you going to a freestanding radiological, that's all they do, or going outpatient at the hospital. And it can be as much as a $3,000 or $4,000 difference for that type of situation. So just a tool that you have available to you. I'm going to briefly mention SEBCO is offering an employee assistance program to all of our member counties. Geauga has been offering an employee assistance program to all of you for a number of years through 3 Cleveland Clinic. You have the additional employee assistance with ComSite, but I'm not going to go into any detail because you have information on the employee assistance program that you have available through Cleveland Clinic. Lastly, the only change to the benefit, and this is for all of our SEBCO member counties, and this is this handout, and it's the 90-day maintenance program. If you are on a maintenance medication, as of January 1st, you'll be required to fill that in a 90-day fill. You will be allowed to have 2 complimentary 30-day fills in 2022, but then you need to go to a 90-day fill. You can do this through retail, or you can do it using home delivery mail order. The first time you fill a maintenance med in 2022, Anthem's going to send you a letter, and they're going to say, you have 1 more 30-day fill available, and then you need to move to a 90-day. We want to be sure to give you adequate time because it will require your physician to write your prescription differently. If they've been writing it to be filled at 30 days, they now need to write it to be filled at 90 days. Many of you are already doing 90-day fills, but this is a mandate on maintenance meds. If you have a question as to whether your medication is a maintenance med, you can call that toll-free number on the back of your ID card that says Anthem RX, and they'll look up your medication and they'll tell you, is it a maintenance med or if it's not. Maintenance meds are medications that you take every day, that you're going to take for the rest of your life. Typically blood pressure, they're usually not particularly costly medications. I myself am on levothyroxine, which is the generic for Synthroid. That's a maintenance med. I gotta take it every day for the rest of my life. So I must do a 90-day fill as of this point. Your prescription benefits are at the bottom of the summaries in your book. And so the way your plan works is, if you're getting a generic medication, which is the tier 1, if you're filling 30 days, it's $15 or the cost of the medication. If you're filling 90 days, it's $30 or the cost of the medication. So the way your benefit plan is set up, when you're doing a 90-day fill, you're getting an extra 30 days in there without paying a copay. So there shouldn't be a hardship there for you to fill it at a 90-day. To tell you why we're doing this, behind the scenes, every time you fill a medication, what you don't see is there's a dispensing fee that is being paid by Septo and Jaga County. So if we can save 2 dispensing fees, it's a significant dollar amount at the end of the year. Any questions on how that works? Then lastly, we've given you a little helpful number sheet that has all of the various programs that you have available, so that on a single sheet you have all the different customer service numbers so that you can reach them. Kelly mentioned the wellness program briefly. You should have received this in the mail if you were enrolled in the plan as of September 1st. And this is just kind of an overlay of the wellness program. Jaga County will be providing additional information about what they're specifically going to do. But just a reminder that you do have a wellness program. Well, that's all I have, so thanks for coming.